This is my presentation on the stroke-specific quality of life scale. So we're going to talk about the general information about the SS-QOL scale, my administration video, scoring, and then normative information, psychometrics, MCD, and MCID. So just some general information. The SS-QOL assesses health-related quality of life post-stroke. The age range is 18 plus. The population is specifically stroke patients with mild to moderate stroke. There has not been a lot of research done on severe stroke patients. This is a patient-reported outcome measure, and it takes about 10 to 15 minutes to administer and score. So specifically about the SS-QOL, it assesses 12 domains, being mobility, energy, upper extremity function, work and productivity, mood, self-care, social roles, family roles, vision, language, thinking, and personality. So this is a self-report, and the answers should be given in reference to the past week. And then the materials needed is just the paper, the assessment, and a pencil or pen. So here's my video. I'll attach another link so you can watch it separately. So scoring, the range is from 49 is the lowest score to 245 is the high score, and high scores indicate that the person is higher functioning post-stroke. So 1 point would be if they answered total help, couldn't do it at all, or strongly agree. 2 points would be a lot of help, a lot of trouble, or moderately agree. 3 points would be some help, some trouble, neither agree nor disagree. 4 points would be a little help, a little trouble, or moderately disagree. 5 points, no help needed, no trouble at all, and strongly disagree. And the different questions or statements on the assessment will correlate to either them answering with like the total help, a lot of help, or like they couldn't do it at all, they had a lot of trouble, or using the strongly agree, moderately agree, etc. And for normative information, there wasn't a whole lot of data, but Williams did a study in 1999, and it had 34 acute ischemic stroke patients with a mean age of 61, but participants had to be 18 or older. And then they were assessed 1 month post-stroke and 3 months post-stroke. And these are just the mean scores of if they were a lot worse, a little worse, same. When answering the questions on the SS-QOL, for reliability and validity, overall it had pretty good reliability and validity. For internal consistency, Cronbach's alpha range from adequate of 0.75 to excellent 0.89, proving that there's a strong internal consistency. Test retest, one study administered the SS-QOL and the scores were highly correlated with a 0.92, showing excellent test retest reliability. And inter-rater reliability, the SS-QOL was administered by 2 different trained professionals within 2 hours of each other. The scores from both were highly correlated, again at a 0.92, suggesting that there's excellent inter-rater reliability. For validity, for criterion, when analyzed using a multivariate analysis, it showed that the SS-QOL summary score significantly predicted the post-stroke health-related quality of life. And for construct validity, most domains of the SS-QOL correlated with the Bartel index, the Beck depression inventory, and subscales of the SF-36. For the minimal detectable change for the mobility domain, it had a 5.9, for self-care 4.0, and for upper extremity function a 5.3. And for minimal clinical important difference, MCID, mobility ranged from a 1.5 to a 2.4. Self-care was at a 1.2 to 1.9, and upper extremity function was a 1.2 to a 1.8. And then here's my references.